Unmute. Unmute. Good afternoon, everyone. So thank you so much. Thank you for the food. And thank you for our participants who patiently waited online. So we shall start the remaining topics of our program for today. So to also share their distinctive and excellent rabies control system for One Health coordination, may we call on Dr. Louis Mar Peteros from the City Veterinary Office of Antipolo. A round of applause, please. Thank you.
Hello. Pleasant afternoon to everyone. I guess every one of us has already eaten house lunch. So I'm not good at speaking in front of many people, but I'll try my best to go through it. Okay. So my presentation would be all about strengthening links through One Health approach. It's an overview on how we do rapid responses in our city, Antipolo City. Okay, so when we say One Health approach, it's almost every one of us already knows about this. One Health, on basic terms or in basic definition, it includes the health of human, also the health of animals, and also the ecosystem. So bringing them into one, we can achieve One Health. Together with collaboration also, coordination, and communication. Okay, so another definition of One Health would be multiple sectors, may it be in the private or government sectors or establishments or other health workers. We work together to achieve better public health outcomes. So also it's a collaborative whole of the society, whole of the government approach to understanding, anticipating, and addressing risks to global health. It is defined by the WOA. So let's focus on collaboration. In its simplest terms, collaboration is working together with other groups or groups of people to achieve a specific goal. Keyword for this is consistent. We would want a member of a certain sector or certain group to be consistent enough to actually do or carry out their task or duty. Kasi sabi nga nila, sa mga for those who are looking for a relationship, magaling lang sa umpisa. But the but the sustainability is not there. Sabi dun sa iba ha. So sa mga nakarelate po, sorry. So anyway, going back to the discussion, consistency is one of the key, okay, towards a good One Health approach. So let me share you a story of this. This is from the street, Sitio Oreta in Barangay San Isidro. So what happened here? Where's is this the point? Sorry. Sorry. How can I list this is the one? Okay. Yeah, thank you, Doc. So what happened here was we did an interview and contact tracing to a suspected. It was actually a report from a concerned citizen, an affected citizen from our community. It was first reported to the CHO, City Health Office. Then the City Health Office then forwarded the report to us, and we kind of meet in that area to do the investigative works or investigative reports and also the contact tracing. We then later found out that the dog showing the signs of labored breathing, um, lethargy, lack of appetite, and also discharges from from ocular and nasal discharges. We then suspected it as a distemper case rather than a rabies case. So client education, we told the owners to, or we suggested the owners to at least do testing for distemper. I don't know if they already had the test done, but yeah. Okay. So next would be communication. So we are in the era of technological advancements. So with the help of social media, especially Facebook and Messenger, a while ago I heard Doc explaining about they have GC and all that. But for us in City Vet Antipolo, we have a page, FB page. Then almost every day we receive lots of complaints, reports about animal bite victim, human bite victims, and all that. And also dogs or cats that are for animal trapping. Okay, so another one would be personal. So our office is open from 9 to 5 p.m. to actually cater or to accommodate walk-in patients. So aside from basic clinical works, we do entertain patients or clients that has a complaint, and also through phone. So this is an example of a complaint or a report. So the first one, it came from, how do I do this? Sorry. So it come from it's a school administrator. Then he's a concerned one because some of the students had been beaten by a suspected rabies dog. It was a roaming dog around the campus or around the school. So the next slide, or rather the next picture here, it was initially posted in a private group, namely the Santa Elena Village. So concerned citizen again forwarded the information of this roaming dog, roaming brown dog, that it had also beaten humans, especially kids in that specific area. So one good thing about the technology now, we have also the cell phones po. The concerned citizen can easily take pictures of dogs who are for trapping. So it would be an easy access or an easy way for us to identify those of dogs that are roaming around the streets. Okay. So this is just a representation of what we usually do. That's Doc Eyang over there, attending clients' concerns, and also through phone. There's Ate Myra, our administrative aide in the office. So, am I a bit too fast? Sorry. For coordination naman, it is working like a zipper. So without the other, you can't do anything. It's an analogy of that. Coordination, we can coordinate. Proper coordination leads to a better public health outcomes. Especially, we also coordinate with different sectors such as local coordinators. Like in this situation, Doc Eyang, they received a courtesy call from a barangay captain in one of the barangays in Antipolo. So the transfer of the messages and ideas is also important. Here also, alongside with her, are the members or the representatives from the Japor project, and also included there are Doc G also as a representative of our team in City Veterinary Office. So you can see that there is a collaboration, there is an open communication between these different teams. We are functioning differently from one another. We may have different jobs or job description, but in these situations like anti-rabies eradication programs, we come up with teamwork. So one good characteristic for having this is being cooperative. We want members also or people also to be cooperative, actively engaged with this kind of situation, emergency situations. So another story here, it was dated 5/16/2023. I was interviewing CTO, or should I say a small community in our city, or homeowners association officer. This is actually endorsed or endorsed to me that time. I wasn't assigned to that area, but for investigative works, I was tasked to do the job. It was also reported na this area is the hotspot also of the city of Antipolo. It's in El Dorado in San Jose. So the cases of rabies, both humans and animals, are very rampant in that area. So in the another picture, you'll see that I'm interviewing also and contact tracing. This is the case from M. Marcelano High School. On the left part, he's the school administrator, and next sitting next beside me is the one who reported the case. So after receiving the case, we immediately conducted the interview, the questions and answer po. And also after receiving also all our gathering all the necessary information and also trapping the dog, and turned out positive, we immediately conducted the ring vaccination afterwards. So it's not seen in the presentation, but we also gave posters of the for animal awareness. So this is personally actually close to my heart, because I was actually the one. It was first reported to me personally. This is a case from a good friend of mine in Antipolo. She was a veterinarian. She asked me over the phone. She asked me about if I can accommodate or test a suspected positive dog, as the dog is showing signs of rabies. So they were given the chance to, or the choice rather, to test the dog in our office, or they go directly to BAI. But they chose to send the dog to our office, and the dog turned out to be positive. So also on this slide, you can see that the address or the location is in Bagong Bayan, Teresa, Rizal. So we have no direction over such areas because we are in Antipolo City. The coordination or the communication and the collaboration comes in when we suggested and when we turned over the case to the provincial veterinary office po. So that's for further investigation, and also if they do the ring vaccination afterwards po. So next. So this is the case po from Animal Bite Treatment Center. The client initially went to the City Health Office to receive post-exposure shots. So the City Health Office then turned over to us this case or this report to further investigate and to do the investigation and also the Q&A for these patients. We actually asked also how many dogs were affected that time, if they are beaten or if they are just exposed. If they are beaten, then we will if they either they are beaten or they are exposed, they will be captured for observation in our dog pound. So just a quick overview of how the diagram of coordination works in our city. So, for example, the private veterinary clinic refers suspect rabies case to us. Then we do the interviewing, as I said earlier. We ask about how many dogs were affected, how many, if there are cats or if there are any other roaming dogs in the nearby area. And we also assess so that we can assess on the severity, on the scope of how far the extent of the like damage of that area. Especially if the dog is roaming, then we would anticipate the area would be larger. Okay, if it's not if it's confined, like for example in a case in private veterinary clinic, the dog was already confined in the clinic. So that it's like the rabies virus is enclosed to that area also. Next would be we do the recording. Okay, we do the recording, we do documentations also, and we do the testing. And we coordinate it with the CHO, especially if it's positive. Okay. Then as for the individual with walk-in clients, we if they report an animal bite incident or rabid animal, they will reach out to us. We again conduct the interview, assessment, recording, test, and if it tests positive or even negative, we will relay also the message and coordinate to the CHO. With the Animal Bites Treatment Center, as previously viewed a while ago, they refer bite victims for reporting. Then we do again the investigation, interviewing, assessment, record, and test. If it's positive or negative, then we coordinate with the CHO. As with the school, in case of Marcelino High School, they report bite incidents or suspect rabid animal. Then the CVO will again interview, assess, and record, and then test. Then relate to CHO and vice versa. Then we will follow up. The follow-up effect is kind of delayed. So it happens usually almost simultaneously. After the receiving or after having the results. That's literally the icebreaker of that presentation. I don't have any talent, so I can do the icebreaker. So thank you for that. Anyway, and that's for the follow-up is kind of delay. So it almost happened almost simultaneously. After the testing, positive or negative, we follow up or we give feedback. We communicate and coordinate with the involved persons, especially the bite victims. We relate to them so as to immediately for them to immediately seek also medical interventions or post exposure prophylactic. Next would be after the testing, then we report and coordinate it to the barangay hall. Okay, then the barangay hall will then turn to sitio on the HOA officers, then they coordinate. Then we will do the ring vaccinations immediately. Yun. But in reality, what we usually realize is that not all the time the report will be initially reported to us or the complaint will be received by the city veterinary office. Sometimes the report will be initially reported to the CHO. Then the CHO will then forward the information to us, then we will do our side. We'll do the testing and also the recording for animal bite victims and all. As with the case of individuals, dahil nga po marami pong nakikimarites na po ngayon, those kind of marites po are kind of beneficial because some of the marites po, they relay information to another marites, and the marites will then turn to us. They will forward messages that there's a roaming dog around the corner. They will also requests for animal trapping, especially how many dogs were being seen in Antipolo, just in one barangay. They also we seldom, or rather we usually receive requests for animal trapping. Okay. Realizations on rabies cases. Through time, we realized that several specimens came from puppies. Those puppies, as expected, they were all unvaccinated. Some of the adult ones or the mid-aged ones had vaccination, but it's already lapsed, or it's already like expired. It hasn't been updated. Most of our cases come from places of high and human stray population density. In our case, it's in Barangay San Jose, especially in the boundary of El Dorado and the lower parts of that sitio. So we receive lots of reports from that area. So moving forward, what will we do next? I think one of the best solutions for this is a revision for our anti-rabies vaccination protocol. So for those areas that are considered high risks of rabies, barangays that are high risks, we should, I think we should prioritize to vaccinate the area early as possible. And if possible, we can repeat it every 6 months. So then we can do also full force vaccination. For example, all of the members or all of the personnels of the CVO will be delegated to a specific area, especially the San Jose. Then we will try to finish all the vaccinations in the shortest time possible. Next would be for rabies surveillance and monitoring. One of the proposals would be having an animal health worker in each barangay. So what's the purpose of, or what's the function of the animal health worker? So the animal health worker, as you can remember, from the previous slide of Doc G, we don't have a direct figure or exact amount of how many stray dogs and cats are there in Antipolo. Even in one barangay, we don't have that exact amount. So what would be the function of these animal health workers is like a census work. They do the census work, like counting if it's possible, counting the stray dogs and cats, and we record that. And I think that would be good stepping stone for us to attain a almost rabies-free environment in our community. So before I leave, I would give everyone, it's everyone's health. Together, we can find concrete solutions for a healthier and more sustainable world. So I guess that's the end of my presentation po. Thank you for listening. Thank you.